Hi and welcome to my YouTube channel. My name is Dr. Tolu, and in this video I'm going to be talking about 5 things you should know about chest pain. If you like what I have to say, please hit the subscribe button, hit the like button and leave a comment for me. And if you have a topic you would like me to discuss sometime in the future, just leave it as a comment for me and I'll do my best to get to it as soon as I can. Alright guys, without much ado, let's begin. First thing that we should know about chest pain is, what is chest pain? For the purpose of this video, I'm going to be talking about things that you might feel in your chest, even though they might not be strictly pain. So this video is going to encompass different sensations that you may have in your chest that some people might call pain, or some people might have different words to describe it. Some people might have chest pain and then they describe it as a sharp pain. Some may call it a dull pain. For some, what they feel is a burning sensation. Some may feel it like a stab in their chest. But all that are different types of ways that people feel pain. And when talking about chest pain, it's really important to describe some things about the pain. Parts of the chest where you have the pain, the nature of the pain, when it started, how long it's lasted, if the pain has spread to other places, because some people might have chest pain and then it spreads to maybe their shoulders or their neck or their jaw or their back. And all these things are really important when clarifying the nature of the pain. The second thing we are going to be looking at is, how common is chest pain? The answer is simple. Chest pain is pretty common. In fact, what statistics show is that about 20 to 40% of the general population worldwide will experience chest pain at some point. In the United States, chest pain is the second most common reason for people reporting to the emergency room. In fact, chest pain is responsible for about 8 million visits to the emergency room every year in the United States alone. So if you've ever had chest pain, or if you're having chest pain even as you're watching this video, you are not alone. It is very common. Number 3 on the list is, what causes chest pain? When we talk about the causes of chest pain, we can broadly classify them into 2. We can classify them into cardiac causes or heart-related causes and non-cardiac causes. That means causes that are not related to the heart. It's very important for me to mention at this point that many cases of chest pain may not be heart-related. And many cases of chest pain are not emergencies and they are not life-threatening. But then the reason why it's important to pay attention to every form of chest pain is because of the minority which make up the life-threatening cases. When chest pain is life-threatening, it can be really bad if not treated promptly. One common type of chest pain that people have, and it's quite common especially in young people, and it's what we call precordial catch syndrome. So I don't know how many of you may have had some kind of chest pain, maybe when you're sitting and you try to stand, or maybe when you make sudden movements or you inhale, you just feel like a sharp catch in your chest, usually on the left side of your chest. Many times that kind of pain is due to what we call precordial catch syndrome. Precordial catch syndrome happens when there's an irritation of the nerves in front of your chest. And when we talk about precordial catch syndrome, we understand that it is not something life-threatening. In fact, there's really nothing you do about it. It lasts for maybe a couple of seconds, or in some cases maybe a few minutes, and then it goes away on its own and you may never feel it again. But that said, if you have any pain that is severe or any pain that just keeps happening, then it's important to report it. So now that I've mentioned that, let's go back to the classifications. First, we'll start with the cardiac causes of chest pain. Many times people who have chest pain that is related to the heart may say it is not really pain. They may describe it as some form of discomfort or some form of pressure or tightness or fullness in the chest. Another thing about it is that when people have chest pain related to the heart, they might actually feel it as pain, maybe like a searing pain. So they may describe it as a pain that travels to their back or to their neck or to their jaw or to one or both of their arms. So it's important for anyone who experiences chest pain to describe it as accurately as possible and as extensively as possible when reporting it to the doctor. Under cardiac causes of chest pain, we have angina, which is chest pain that is caused by poor blood flow to the heart. In cases of angina, the cause of the poor blood flow to the heart is due to thick plaques which develop in the inner walls of the arteries that carry blood to the heart. So if these plaques are in the inner walls and then they build up over time, what happens is that passageway for the blood is made narrower and narrower, and eventually the person may start to have chest pain. Talking about angina, another thing we have to look at is a heart attack. Now, a heart attack happens when there is an obstruction to the flow of blood to the muscle of the heart. Now, I've discussed heart attacks and cardiac arrests, and a link to this video is appearing right now in the top right hand corner. So if you want to learn more about heart attacks, you can just click on that link. Some other things we also have to look at when we talk about cardiac causes of chest pain are aortic aneurysm, which is an enlargement of a blood vessel called the aorta. The aorta is the largest artery in the human body. So when there's an enlargement of a portion of the aorta, that's an aortic aneurysm. And linked to an aortic aneurysm, especially if the aneurysm is not treated, is what we call an aortic dissection. So what happens in an aortic dissection is the inner layers of the aorta separate, blood leaks into those places, those separations in the inner layers of the aorta, and when blood leaks into it sufficiently, that may cause a rupture. What that means is that portion of the aorta bursts. Aortic dissection is a life-threatening condition, and if it is not treated as a medical emergency, the person suffering from an aortic dissection can bleed out within minutes. Sometimes people experience chest pain because of an inflammation of the sac around the heart. So when you have the heart, you have the sac around the heart. There's an inflammation of this sac. That's what we call pericarditis. People who have pericarditis will tell you that maybe when they try to lie down, they feel the pain more, or when they try to breathe in, they feel the pain more. And now we move to the non-cardiac causes of chest pain. Top of the list for the purpose of this video are digestive causes. Under digestive causes, we have heartburn, where the stomach acid, which usually is in the stomach, may go up into the esophagus, and then it causes a burning pain which can be very severe. And this burning pain can be felt in the chest. Person also having non-cardiac causes of chest pain may have swallowing disorders, which can also present as pain. The pain may also be due to problems with the gallbladder or problems with the pancreas. Maybe like an inflammation of one of those organs can lead to chest pain. Chest pain may also be due to muscular or bone problems. For instance, if the person has suffered an injury to the ribs, or if there's an inflammation of the cartilage of the rib cage, that's costochondritis. It may also be due to problems with the muscles around the chest. So if there's soreness of the muscles there, that can also cause chest pain. Chest pain may also be related to the lung. For instance, in the case of a pulmonary embolism, where there's a blood clot in the lung, that can cause chest pain. It may also be due to what we call pleurisy, which is an inflammation of the sac that covers or surrounds the lung. And then for those who may have high blood pressure in the arteries of the lungs, or those who have asthma, or those who may have suffered a collapsed lung. Other non-cardiac causes of chest pain may be to shingles, which may cause chest pain that starts at the back and then goes towards the chest, or those who suffer panic attacks, which is, like the name suggests, an intense feeling of panic, which may come with chest pain. In fact, panic attacks can cause chest pain, and the chest pain caused by panic attacks may be a bit difficult to differentiate from a heart attack because they can be very similar in the way they present. So while this is not an exhaustive list of causes of chest pain, I've tried to look at the cardiac and the non-cardiac causes, and then to explain the ones that happen commonly, or the ones that when they happen, they can be life-threatening. For instance, the aortic dissection. Special mention to COVID-19, which can also cause chest pain. I don't think I need to say so much about COVID, because COVID is something that everyone in the world has had to read about at some point in time. And the fourth thing we'll be looking at is, when is chest pain a medical emergency? This is very important. The first thing I want to say is that you should please always see your doctor, especially for chest pain that starts suddenly and chest pain that you would describe as being severe. Please see your doctor. Also, when looking at chest pain that should be reported as an emergency, if you have a chest pain, for instance, that now travels to maybe your neck or your jaw, or moves to your back or to one of your arms, that is not a good sign. Also, chest pain that comes with chest tightness or fullness, chest pain that comes with maybe nausea or vomiting or sweating, chest pain that comes with difficulty with breathing or a change in your breathing rate. Maybe the person now starts breathing much faster or starts breathing much slower than they usually do. And also chest pain that may now come with the person's lips looking blue or their nail beds looking blue, not as pinkish as they usually look. Please report as an emergency. Chest pain that comes with confusion, chest pain that lasts for more than 15 minutes, please run to the emergency room. The fifth point we'll be looking into about chest pain is, what will your doctor do when you report chest pain? This is really important. Depending on where you report the chest pain to, that may determine what your doctor does. For instance, if you report it to the emergency and then they ask a couple of questions, maybe if the person having the chest pain is able to answer those questions, or if maybe it's the person who brought the patient to the emergency room answers those questions, based on what you tell them, it will be treated as an emergency. But let's say you report in a non-emergency capacity to the hospital and you are seeing your doctor. What your doctor will most likely do is to ask you questions about the chest pain, many of which I've already mentioned. For instance, the nature of the chest pain, when it started, how long it's lasted, the part of your chest that you feel it, if the pain is moving to any other part of your body, if the pain is accompanied by maybe shortness of breath or any other symptom, if you've had the pain before, if the pain comes and goes. Those are really important things that your doctor may want to know. The next thing your doctor may want to do is to examine your chest, may want to listen to your chest with a stethoscope, may want to palpate and then do a couple of other examinations on your chest and even other parts of your body if your doctor suspects that maybe the pain you're feeling in your chest is coming from somewhere else, like your abdomen or some other part of your body. Your doctor may also ask you to run some tests. If your doctor is maybe suspecting a cardiac cause of chest pain, then tests like an ECG, maybe a chest x-ray, also maybe a test like an echocardiogram. Depending on what your doctor is suspecting, they may ask you to do tests that may let them know if the problem is from the heart, or they may ask for tests that may let them know if the problem is from somewhere that is not your heart. Maybe if it's your lungs, they may want to do one test to check your lung capacity or to check if there's any ongoing infection in your lungs. If they suspect maybe this is due to a panic attack, then what they may do is to offer tips to help with panic attacks or refer you to appropriate mental health services who are better equipped to help with those kinds of issues. So guys, this has been a long video, but I'm happy you stayed till the end. In this video, we have examined 5 things that you should know about chest pain. So if you like what I had to say, please hit the like button, hit the subscribe button, and leave a comment for me letting me know if you found this video useful or not. And if you have a topic you would like me to discuss in the future, also leave it as a comment and I'll do my possible best to get to it as soon as I can. But until we meet again next time, bye.